The climate crisis is a health crisis, and it's killing people both in this country and around the world in very large numbers.
The data is telling us quite clearly that the more that we are burning fossil fuels, the more illness we're creating, the more deaths we're causing.
What we saw during COVID was actually one of the few times that in a crisis moment our government did act as though there was a real emergency.
Good afternoon, and thank you for joining us for this Emergency Climate and Health Action Briefing.
When it comes to the biggest health threat, which is far more consequential than the pandemic ever was, it feels like there's silence.
As your Chief Medical Officer, I want to tell you that the climate emergency is causing an increase in deaths and severe illness.
It's deeply concerning that 2024 was the first year to exceed 1.5 degree targets set by world leaders in 2016.
If they wanted to treat the climate crisis like an emergency, then they would be holding public health messaging campaigns and involving people who they need to in terms of public health experts and scientists to really guide the way.
If the politicians genuinely care about health, then really what we need to do is act on the greatest health threat of our time.
Tackling the way we produce food and what we eat is a major part of responding to the climate emergency. The government has put together a National Food Advisory Board, and on this board we have literally 9 out of 11 or 12 people are industry lobbyists.
With no representation from public health, climate science or environmental health.
Our current way of eating is harming our health, our children's health, our environment and the planet. It is not sustainable and it cannot continue.
Shifting towards eating predominantly plant-based foods is really essential to trying to bring down greenhouse gas emissions that are most associated in particular with red meat production.
I'm so thankful that today we can begin to hope that practical, honest and urgent steps to protect the future of our children will be taken.
There are solutions to this, a sustainable health diet which can actually feed a growing global population in a way which will reduce deaths secondary to poor diets and reduce our environmental impact as well.
We have shamefully placed corporate interests and the profits of the super rich over the health and well-being of our population. And this is unacceptable, and for this I am truly sorry.